How long do you spend writing your progress notes every day? If it's over 30 minutes, you should check out Describe. Describe is a HIPAA compliant AI note taking software that I and many of my students use daily. It saves me 1 to 2 hours a day on my documentation around consulting, and I know it's going to save you more in counseling. Also, it customizes exactly to my own writing style. I recommend that every therapist give it a trial. It's free. Go to describemed.com to get started for free. Again, that's describemed.com to get started for free. This is the Practice of the Practice podcast with Joe Sanok, session number 1205. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast, where we help you build a thriving private practice that you absolutely love. We also talk to a lot of interesting people, and I just get to follow my curiosity and dig into some of these conversations to talk about just different things that matter to us as therapists. We had the Brighter Brains series, and just some of the things we covered during that series. We discussed trauma. We talked about veterans recovering from moral injury. And then we also talked with therapists and podcasters, Jane and Hannah. We're talking about the Are We Happy Yet podcast and kind of some just approaches to happiness. So a lot of interesting podcasts we just covered. Today we're talking about the future of dying. It's interesting. My parents are in their 70s, and my mom's had a whole bunch of health concerns kind of throughout her life. She actually was the first child to have open heart surgery at the Cleveland Clinic back in the early 50s. And, she's been in and out of the hospital a lot in her life, whereas my dad has not been in the hospital very much at all. And around Thanksgiving time, he spent about 12 days in the hospital. And it was really interesting how it was kind of normative in our family for my mom to be sick and go in and out of the hospital. And like, that's just kind of normal. But then when he was in the hospital, it was just a very different kind of thing to conceptualize for me. And so I started thinking about, what do I want to make sure that he knows, before he passes? And he didn't pass. He recovered great, and the team did a really great job. And he's kind of back to his normal, healthy self. But it got me thinking more about death and about dying and about just, the people in my life that have moved on into the next world or the next life, or however kind of your concept of death and dying is. And so today I'm really excited about hanging out with Ira Byock, who is a medical doctor and leading medical authority, author, and public advocate for improving care for people living with serious medical conditions. His article, Taking Psychedelics Seriously, in 2018 sparked renewed interest in psychedelic-assisted therapies within the field of palliative care, and his book, The 4 Things That Matter Most, is widely used in counseling within palliative care, pastoral care, and psychology. Ira, welcome to the Practice of the Practice podcast.
Thanks, Joe. Thank you very much for having me.
Yeah, I'm so excited to have you here. This is a topic we haven't really covered a whole lot on the show. And so to try to fit in all sorts of discussion around it in half an hour, we'll see how we do. We might have to just have you back on the show at some point.
There's a lot to talk about for sure.
There is. Now, when it comes to death and dying and hospice, and was that kind of the medical work that you knew you wanted to go into in your career, or did you kind of find...
No, not at all. Oh my gosh. I went to medical school, started medical school in 1974, just so listeners can have a context of who they're talking with here. And I was quite sure that I was going to be a rural family doctor. I wanted to do cradle to grave family medicine in a rural area. And I chose a very intensive residency program that was specialized in just that. But life had different things in store for me, and it's relevant to this conversation. What happened? I in the midst of my medical training, my internship year, I encountered a few people who were dying, and just in asking them how they were, Mr. Rodriguez, how are you doing this morning? Having had the talk with Mr. Rodriguez just a couple of days before, he knew he was dying, and he was uncomfortable. Mr. Rodriguez, how are you doing today? He looked me straight in the face and said, I'm well, doctor. How are you? I I took my breath away. I had no idea what that meant, and I thought, well, it's the morphine, or it's the steroids I'm giving him, which sometimes make people euphoric. But every once in a while, during those first months of my training, I had encounters with people in which, if I respected what they were actually saying, I had to acknowledge to myself that they were expressing some sense of well being while knowing full well they were dying. And honestly, I did not have language or a kind of a framework to put that in. And I realized early on that the world was teaching me something here that I needed to figure out.
Mm. And did you take that? You said the world was teaching you something there. Did you take that as a kind of personal lesson for your life or more of a broad lesson to help your patients?
Oh, well, both, but first and foremost, it was for me. Um, you know, because at that time of my life, it was hard to separate myself personally from the 100% devotion I was giving to being a doctor and to learning this stuff. And I have to tell you, and this will relevant to where we're going to go in this conversation. My guess is that I was steeped in human development. I went to medical school at the University of Colorado, which was a huge pediatric developmental center, with C. Henry Kemp and Lulu Lumchenko and all of these early developmentalists, pediatric developmentalists there. I learned Maslow and Erickson and Piaget, and I also learned family systems theories and all of that. And that was all in my head as I was starting my medical training. And and even at that time, by the way, I was a meditator. I was I had done Buddhist meditations for quite a while, um, and all of that was sort of swirling around. But my focus was on being the best doctor I could be, and again, doing cradle to grave family medicine. So in in my mindset, the highest therapeutic goal I could have for a patient of mine was a sense of well being as they were leaving this life. But I had no clue as to how to make that happen. All I saw every single day was people suffering with advanced illness. How how could you at that time I was struggling with how to integrate a evidence that somebody was well during a time when they, were jaundiced and itchy and painful, and had pain, and their bowels weren't working. Um, and that was my focus. Obviously, was to make them feel well physically, or at least alleviate suffering. But I wasn't prepared for the phenomenon that people could be well
Hmm.
in these difficult, often, well, always sad and sometimes tragic times.
Yeah, I want to dig into that word well. It sounds like, and correct me if I'm wrong, that in some ways, Mr. Rodriguez saying that he was well, that challenged maybe what the medical training had told you, what maybe your life upbringing, society, culture, all those things of, what death and dying was, and that for someone to be well and to have that be one of the focuses of the medical team to emotionally be well towards the end of the life maybe shifted away from maybe what you had been taught. Is that accurate?
Well, it wasn't even part of what I was taught. You know, medicine as it is taught then and now, and is a problem based model. The twin, health problems of human beings are illness and injury, and our goals are cure, life prolongation, or longevity, restoration of function, right? And the assumption built into this, and it is an assumption because it's not usually questioned, is that the best we could hope for and ought to work toward as doctors is restoring people to a sense of quote unquote health that they had before their diagnoses. What I wasn't prepared for, and I still think, frankly, should be the next big thing in American psychology and American culture, should be that human beings have the potential, the human potential, to grow individually and together through these most unwanted, difficult times of life that we call dying.
Mhm. Now, when you see people, I guess when I'm thinking about like therapists or doctors, where would you say we're at now in regards to how most people kind of typically think about dying? And then where do you hope that we're headed?
I don't think most people think about it at all. We put a lot of energy into not thinking about it, frankly. You know, even when somebody gets a serious diagnosis, cancer or heart failure or ALS, oh, don't think like that. Don't talk like that. We're gonna beat this damn thing, right? It's the backdrop that voice that we try to suppress in our own psyches. I think, however, there are multiple cultural currents going on. There is this sort of positive death movement or death friendly movements, and with death over dinners and death
Mhm.
cafes and
Death
the
doulas.
Conversation Project and death doulas and all of that stuff is also happening in and it's real, and it really is evidence of genuine cultural maturation, but it's a small part of the culture, frankly, and it hasn't well penetrated mainstream American culture or Western culture, for that matter. Where I hope we get to, what I'd like to see us get to, is integrating illness and dying and caregiving and grieving within a new concept or new understanding of living fully as human beings. Because all of these things, though they are unwanted, are also normal parts of human life. And I think and American medicine has been complicit in this, but I think if we only see them through a lens of problems, we we are impoverished, and our ability to live fully during all of our lives is really lessened.
Mm. Yeah. And for you personally, like how have you shifted and how have your work with your clients and your patients, how has that shifted in regards to how you think about death now and how you kind of move towards that being well model?
It's been a process. I experience myself as being a mortal human being. I am a whole person. I have not only a body which I value and try to take care of, but I have relationships, a sense of meaning in my life, a sense of purpose in my life, aspirations. All of that are part of who I am. When I sit with seriously ill people, I see them as whole persons. And while I see and try to bring my medical expertise in service of their medical problems, I refuse to see them solely through a lens of their diagnoses and their you know symptoms and their suffering. I see them also as whole persons, and I think maybe what distinguishes kind of the style of uh, medical practice, or my style of palliative care that I have been trying to teach and promote during my career, is that I also look for opportunities within the crisis, opportunities that have value for them. Try to I've written a little bit about the therapeutic use of imagination, and I don't mean that in a kind of a woo woo sense, but to the extent that you can listen to a person's story as if you were the speaker, or see the world through their eyes, to the extent that we can use our sort of receptive imagination to see and hear the world as they might, then you can use your generative imagination to begin to look for things that may be of value to them. People who matter to them that they may not have seen for years. Perhaps it's a former spouse that they lived with, they were married to for 20 years before a bitter divorce. And seeing that as an opportunity, if they so choose, to reach out to the person, to tell them that they've been ill, to perhaps, if they so choose, um, let them know that their shared lives and experience still matter to them. Sometimes there's opportunities for reconciliation between former spouses, or a father and son who haven't spoken in years, or previous business partners who were close friends before a falling out. When one or the other is facing life's end, there may be opportunities to say things that would otherwise be left unsaid. And that's where we get to the please forgive me's and I forgive you's, thank yous and
Mm.
I love you's. That's something that again, in the medical model doesn't come up. Doesn't come up in medical teaching, but I got to tell you, as a clinician, and something I've taught other clinicians for many years now, is that it's such a valuable piece of practical wisdom to just, and I don't tell people they need to do it. I wonder aloud in their presence if it might not be of value to them to say things to people who um, they love or once loved. And perhaps few things that I've learned in my practice have been of more value to the people who are my patients and their families.
Yeah. Listen, I didn't take insurance in my counseling practice because I had no idea how to handle it. The process of accepting insurance outside of a group practice can be tough, but most people looking for mental health care want to use their benefits to pay for sessions. If you're like me and you feel a little scared about taking insurance, or you just want to make it easier on yourself, and you're interested in seeing clients through insurance, Alma can help. They make it easy to get credentialed with major insurance plans at enhanced reimbursement rates. They also handle all the paperwork, from eligibility checks to claim submission and guaranteed payment within 2 weeks. Plus, when you join Alma, you'll get access to time-saving tools for intake, scheduling, treatment plans, progress notes, and more in their included platform. It's going to make it so much easier for your team, so you can spend less time on administrative work and more time offering great care to your clients. Visit helloalma.com/Joe. That's helloalma.com/Joe to get started. You wrote an article a few years back about psychedelics, and how do you see that overlapping with death and dying? And I know there's a lot of research we can cite around that also, but how do you conceptualize the use of psychedelics with end of life care?
Well, before we get to the therapeutic use, let's say that psychedelics um, are the experience of taking psychedelics uh, brings you into face to face with uh, the existential annihilation of your ego. That experience um, is incredibly terrifying and unbelievably scary. But it also reflects on what matters most, and that the psychedelic experience is an experiential model, or training, if you will, for any of us who want to be therapists or healers in um, in what it feels like to be facing, existential annihilation through death. Um, frankly, my own, had I not been a hippie and had multiple psychedelic experiences during my college years, I never would have gone to medical school. I never would have even had the desire, I think, to be of service to people in this manner. Um, and and frankly, during easily 30 years of being a doctor and becoming gravitating toward hospice and palliative medicine, which is a field that I, you know, frankly helped to stand up in the United States. I would occasionally mention in an article or a book chapter that psychedelics are there to be explored for our field because it does have therapeutic potential. These are not the usual drugs of abuse, or the psychedelic experience is not an experience of intoxication that takes you out of yourself. It is in a sense the antithesis of a drug experience or in intoxication. It takes you deeply into yourself in the most honest and unfiltered of ways. So scroll forward now almost 40 years since the psychedelics had become taboo and Schedule One drugs and all of that. The field, thankfully, has begun in a robust way to revisit these medications um, as therapeutic tools. I never say the phrase psychedelic therapies. I say psychedelic assisted therapies because it
Mm.
really requires, preparation or screening of people, preparation, careful attention to guidance and the setting of the experience, and then integration therapy and counseling thereafter. But with that, with the confidence that people build in their therapists and guides, psychedelics and that experience can help people understand their their lived experience in a much clearer way. It highlights the what matters most in life, one's purpose in life, and I think uh, gives real depth to the gift that life and every present moment is to human beings.
Hmm. How do you hope that the way that we kind of think through, and maybe you've kind of hit on this, the way we think through care as clinicians, how do you hope that shifts when it comes to families that are grieving the loss or potential loss of a family member? Like, what does that look like? Because I think traditionally it's been you're sitting with the people, you're a lot of listening. But like, what do you think needs to be added to med schools or counseling programs that would help people to be more effective with kind of the things you're talking about?
Simply to see human life as uh, a life cycle, which um, does in fact end in a person's dying. Seeing um, caregiving and grieving as also parts of human life, that nobody gets out of this life without experiencing loss and frankly illness and suffering. For me, you know it, although I actually see the world through kind of um, Buddhist lenses, it's actually bent me back to being a developmentalist. I really do see the fullness of human life through developmental lenses. And if you think about it, you know, every step in human development, from the toddler, going to preschool um, to the adolescent, going to college, to getting married, to midlife challenges, human development is usually sparred or spurred by um, crises, and those crises are not fun. We sometimes giggle at them. The crisis of the toddler going to preschool, and he finds out that not only is he crying for the loss of his mother, but 2 days later he gets scolded. Johnny, that's not cute. But it was cute just a couple of days ago. It was working for him. And now the same behavior doesn't work. Who he is needs to advance in his own mind. Expectations of people have changed, of his have changed, and well-being requires, an adaptation, a growth in one's personhood, in one's concept of themselves, and an understanding of their relationship to others, the expectations others will have on them. That same kind of developmental crisis and growth model fits beautifully through adulthood. And frankly, illness and death are the natural disasters that await each of us. And the best way to get through a natural disaster, we know, is together, lovingly, supporting one another, being honest, but also tender with yourself, merciful towards yourself and others. And that's what I wish we taught. I mean, I've written a lot about developmental landmarks and task work to achieve those landmarks that apply to somebody with a serious illness. Starts with just having a sense of completion in worldly affairs, turning over the deed of the house or the car to others, giving people their passwords so they can close your damn Facebook account, but also your bank accounts and all of that. But then it moves swiftly to, sense of completion in the important relationships in your life with people in your community, non-intimates, but also then to the people you love or, as I said, once loved. Achieving a sense of meaning in one's life with life review or the telling of one's stories and recording of stories to children or for grandchildren who may never hear them with your voice. More inwardly, and this gets back to kind of the advantages of psychedelic assisted therapies, not only a sense of meaning about one's life, but a sense of compassion toward oneself, a love of oneself, experiencing the love of others, which involves work on worthiness, completion of relationships that extends to, offering forgiveness, asking for forgiveness, expressing appreciation, gratitude, love toward others. These things are not mystical. They're really practical wisdom that I think is available to really all counselors and psychologists. This, if you think about it in developmental frame, this is work that we can help people to do within their own lives and families.
Now, Ira, I always love when there's experts in a certain area, to hear how this impacts your own personal life. Like, what kind of habits or mindsets do you routinely go back to, whether it's on a daily, weekly, monthly, quarterly, annual basis? Like, how does this personally impact you to maybe live life a little differently?
I'm going to give you two answers. I think first is to practice saying those four things in my own life as a tool, a practice for emotional and relational well-being. Please forgive me. I forgive you. Thank you, and I love you. You mentioned that book. I think you mentioned my book, The Four Things That Matter Most. It's one of the books I've written, and I didn't make these things up, but I observed that within a number of cultures there was this cultural wisdom of asking for forgiveness, offering forgiveness, expressing gratitude and love. And you don't have to be dying for those things to be relevant. You just have to be mortal. And in fact, if you think you're immortal, but you love somebody who's mortal, well, those four things still apply. So I practice that, with my daughters, with my good friends, my wife. When it needs refreshing, I'm quick to ask for forgiveness, offer forgiveness, express out loud, express my gratitude and and love. I think
Mm,
the way this work has impacted my personal life is that I've learned to apologize a lot more early and authentically than I did as an adult. I almost said, and now I'm going to say as a male adult, frankly, as a man. I used to, in my early adult years, Joe, I would apologize, sort of, oh, I'm sorry your feelings were hurt, like notice the passive voice, like it's a
hmm
like it's a snowstorm. Oh, I'm sorry it snowed on you, right? That's a mealy mouthed apology. And I've learned to be able to man up, frankly, and to say, I'm sorry I screwed up again. I'm really sorry. That was wrong. Please forgive me. And in a sense, doing that, I've learned, is like standing in front of somebody you love naked with your warts and imperfections, visible, and saying, will you still accept me? Right? It's a
mm,
way of saying, as ashamed as I am of myself, my relationship with you matter more to me than my embarrassment. Please forgive me. Right? That has been, I think, on a personal level, my most profound life lesson.
mm. So awesome. Well, Ira, I always have my last question, but maybe you already hit on it. And that's, if every private practitioner in the world were listening right now, what would you want them to know?
That every client that you have is a mortal human being. That these crises and suffering can not only be suppressed or ameliorated, which we should do, but also that the goal is for people to live as fully as possible, for whatever time we all have. And so, you know, keep your hearts open, remember to breathe, have mercy for yourself, and for all that you're privileged to care for.
Mm. Well, Ira, if people want to follow your work, get your books, where should we send them?
Oh, well, I have a website, irabyock.org, IRA, BYOCK.org. Check it out. I've got most of the things that I've published in academic journals and the like are there, as well as my op-eds and some of the presentations I've given, and access to my 3 books, which started with Dying Well. Second book is The 4 Things That Matter Most. And then my third book is The Best Care Possible. I hope it's of value to the listeners.
Mm. Well, thank you so much for being on the Practice of the Practice podcast.
True pleasure for me, Joe. Thank you for asking.
Well, so many great things there within our show today. Hope you take some action. Hope you, work on some of those things to just be well. Thank you so much to Alma for being our sponsor today. I wish Alma had been around when I had my private practice. I had no idea what I was doing. That's why I didn't take insurance. But if Alma had been there, I would have. And there's no reason that as a clinician, you should be spending hours on paperwork to bill for insurance, or not knowing for sure that you'll get reimbursed for sessions with your clients. If you're interested in seeing clients through insurance, but don't want to navigate the process and paperwork on your own, Alma can help. They make it easy to get credentialed with major insurance plans at enhanced reimbursement rates and a guaranteed payment within 2 weeks. Visit helloalma.com/Joe. That's hello, ALMA.com/Joe to get started. Thank you so much for letting me into your ears and into your brain. Have an amazing day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.